Insurance Association has strong words for government over national health insurance. The opposition leader runs to the defense of doctors following a cabinet minister's comments. Law enforcement still lost as to how NHI will affect them. Plus, 7 men and 1 woman charged with the latest drug bust. We've got those stories and a lot more coming up tonight. I'm Kyle Joaquin, and NB12 starts now. Topping news tonight, members of the Bahamas Insurance Association have described their experience with the government over national health insurance as the worst they've ever had in an independent Bahamas, and said it appears the government is pushing forward with a political agenda. The association also used the opportunity to defend its president in the wake of what they called disgusting remarks made by Tall Pines MP Leslie Miller.
It seems fair to state that this is the worst experience that the BIA has had with any sitting government in an independent Bahamas. We are appalled that an industry that is a major component of and contributor to the Bahamian economy has been treated in such a manner by the government.
For members of the Bahamas Insurance Association, it's a matter of respect. The group represents 31 insurance companies, brokerages, and agencies in the Bahamas, many of whom have been around for decades. But the association today once again said government has only been ignoring their recommendations and expertise when it comes to insurance and have been moving full speed ahead when it comes to NHI. Tina Cambridge of Generali Worldwide and a member of the BIA's NHI committee said it appears as though the government's motive isn't national, but instead political.
Unfortunately, all of us, BIA, the doctors most recently, the chamber, etc., we're all saying that we are being dismissed. Our cries have not been heard, and it is as if the government is plowing along with a political agenda as opposed to us having a national platform for the delivery and the building of a proper UHC platform for the Bahamas.
There are several doctors in disagreement with the contents and layout of NHI who have said they won't sign off on it. Cambridge questioned who the government is listening to if doctors and insurance professionals aren't acknowledged.
It really depends on what our long-term strategy and goal is going to be, but we have not seen a strategy. We have not seen a long-term plan. So therefore, we're going from what the premise of what we have seen, and there are not enough details in there for us to say that we are truly going to launch this from as best a footholding as we would like to see for the Bahamas.
There's also the registration process, which started on Monday. According to the BIA, it's not real insurance registration, but only more people getting the new NIB smart cards.
You're not sure if you're getting out of that 5,000, if 10,000 of those people will have diabetes, hypertension, high chronic illnesses. Or one doctor might turn out to get 50% of the people who are healthy and another 50% who are high risk. So that cost, it muddied the water with cost. And this is not the way registration should be done.
And then there were comments made by Tall Pines MP Leslie Miller, where he incorrectly pronounced the name of the BIA's chairman Emmanuel Kamalafe and recommended that the African native keep his comments to himself or take them back to Nigeria and start universal health coverage there. The BIA today expressed disgust over the matter and questioned what they called the Prime Minister's refusal to reel Miller in.
Yes, Mr. Komalafi is Nigerian, and indeed, he is proud of his African heritage. He has, however, adopted the Bahamas as his home and has embraced the Bahamian culture. He is married to a Bahamian woman and is the proud father of 3 children, all born in the Bahamas. In light of these recent derogatory remarks and the deafening silence on the part of the government, we are constrained to ask whether Mr. Leslie Miller is a surrogate for the government, and whether the Prime Minister views the insurance industry with the same level of disdain.
She said the lack of response from the Minister of Finance or his junior minister is disturbing, and she questions whether they share Miller's sentiments. Members of the BIA stressed that they support universal health coverage, just not the way the government is currently going about it. Well, another concern of the Bahamas Insurance Association is government's plans to create a public insurer for national health insurance. Deputy Chief Medical Officer Dr. DeLon Brennan has confirmed that the Christie administration does in fact plan to create that public insurer that can offer the benefits packages of NHI. Well, Lerone Burrows, president of Family Guardian Insurance, said the idea of a public insurer makes absolutely no sense.
Our opinion is that it is totally unnecessary at this point in time for many reasons. One of those being the fact that based on the experience to date, government corporations have not been run effectively and efficiently, and in our opinion it will be basically another instance of that regard. So our position is that with the current 7 private insurers that are currently available in the health space, that is more than sufficient to meet the needs of the current NHI scheme.
According to Burrows, if government moves ahead with creating a public insurer, transparency could pose a major issue, particularly when it comes to management of that new government entity.
That is another aspect of the public insurer that we have concerns about. One is from a regulatory standpoint. Currently, the private insurers are regulated by the Insurance Commission of the Bahamas, which is a government entity. Here you would have under a public insurer arrangement where a government entity would be regulating another government entity. So there are significant conflicts that will play out in that regard.
Well, opposition leader Dr. Hubert Minnis said if Labor Minister Shane Gibson wants to know who's really greedy, government should reveal its various contracts and signings for items like infrastructural works and BAMSI. Minnis was responding to Gibson's recent suggestion that some doctors seem more concerned about making a dollar than saving lives when it comes to NHI. Well, the opposition leader charged that politicians and not doctors are the greedy ones. Dana Smith reports.
Minnis said it's clear government has missed the point, and as a doctor, he feels personally insulted by Gibson's comments.
Gibson truly want to know who is greedy. What I ask him to do is have the papers publish all the contracts with BAMSI. Let's see who's greedy. All the contracts that the government and the agreements, heads of agreement, have those published. If they want to see who's greedy, do that. Let's see how many politicians are greedy. Let's see where they got their money from. Let's see where they get their wealth from. Let us see who's greedy.
Minnis's comments come after Gibson told reporters yesterday government will not be held hostage by doctors from the Consultants Physician Staff Association who think the mighty dollar is more important than saving lives. The CPSA's president had warned its doctors will not sign on to national health insurance unless their concerns are addressed, and accused government of ignoring and marginalizing the views of local doctors. Minnis said Gibson's comments made it seem as if local doctors are greedy and do not support universal health care coverage, when that's simply not the case.
The government missing the point. This government has demonstrated repeatedly that once you question them, they interpret it that you oppose them. They interpret it as if you are greedy.
The CPSA had voiced concerns about the model of care for delivery of primary care and the need for health system strengthening, among other things. While charging that Gibson doesn't understand the medical profession, Minnis said it seems to him that the doctors at the association merely want more consultation, and to paint them as caring more about money than saving lives is inaccurate.
All the doctors are asking is for proper communication between themselves and government. The doctors want to ensure there's adequate health care for all Bahamians. Doctors, in general, are compassionate, and they are very, very humanitarian oriented.
Although registration for NHI started yesterday and primary care is slated to be introduced in April, private sector stakeholders continue to voice reservations about the plan. Among their concerns, common ones include inadequate consultation and general confusion surrounding NHI implementation. Reporting for NB12, I'm Dana Smith.
Well, even though registration for the National Health Insurance Scheme began Monday, Police Staff Association Executive Chairman Dwight Smith said today that his members are unsure if they will register because they have not been given the green light to do so, and there has been too much confusion that needs to be cleared up. Simone Davis reports.
Smith said as it stands, PSA members are just confused as to what to do when it comes to their health care, and they're not only concerned about themselves, but also family members who are depending on them.
The PSA chairman said they've received mixed messages in a letter from Permanent Secretary for National Health Insurance, Peter DeVoe Isaacs, after writing him a letter inquiring about the role NHI would play in security forces.
It's a lot of confusion because, you know, somebody is saying something on this hand, authority is saying this on one hand, and then on the other hand, you're saying something completely different. Are we going to continue with the insurance benefits that we have now with the agency that now exists? Or are you saying now that what we have is going to be put aside or thrown out, and now we focus on an NHI for security forces?
In a press statement released earlier this week by the National Health Insurance Secretariat, it stated that while all legal residents in the Bahamas are entitled to health care under NHI, those who currently pay for private health insurance can maintain their current policies if they so choose. However, it is possible that their insurance policy may change, given that primary care services may be covered by the government of the Bahamas through NHI. Smith said he believes that the government has failed to realize that by keeping the officers in the dark about NHI, their entire families are unsure about their health insurance as well.
When we met with the NHI says, listen, you don't have nothing to worry about because this not consider you. You already have an insurance provider. You already have that, so this really does not come in path with you. Now, one way to ask why we're so concerned about it, it's just not that our insurance covers the officer, which is a high concern for us, but also our families, our dependents. So what are we saying to them? Because remember, they ain't registered either, because they come under the same plan. They come under the same plan, they benefit from the same plan that the officer benefits from. And so that's a height of concern for us.
He added that the PSA proposed changes to their insurance that would result in each officer being issued a life insurance policy valued at $500,000. State Minister for Finance Michael Halkitis confirmed that the government is studying the proposal, but Smith said communications have been unclear as to whether the disciplined forces would retain benefits under a separate plan from the NHI scheme. He added that now he and his members are in limbo and playing the waiting game to find out if security forces would be a part of NHI or not.
Once we have the same benefits and for officers, that is fine. We're just saying be clear on what you're saying. Are we on this boat or are we on another boat? We can't be on two boats. Only one boat we can be on. And that's why we need to know. And the questions are being asked on this on a daily basis. That what is happening with us with an NHI? Are we a part of the NHI scheme? One would think that if we are, then we should be, a part of it.
Calls were made to DeVoe Isaacs for comment on the matter, but they were not returned up to press time. Reporting for NB12, I'm Simone Davis.
When NB12 returns, 7 men and 1 woman charged with a major drug bust. Stay tuned.